All right, good evening. My name is Hardip, and I am going to be your host for today. It's 8 p.m. Malaysian time. I was going to say rubber time, but no, it's Malaysian time. So, okay, welcome to the Advancing Anatomy Education webinar series. This is one of the many. So we're going to start off with the first session is going to be the basics of facial anatomy. And this is going to be presented by Dr. Safi Kang. And the moderator will be Dr. Kritsada Kowitwibool. All right, among the topics that are going to be presented by Dr. Safi Kang will be understanding the basics of facial anatomy. Number two is fat harvesting techniques. And the third one will be facial fat injection technique. All right. But before we proceed on with this, what I would like to do is to invite Mr. Eddie Liu, who is the founder of FATS, to give a word or two before we proceed on with this session. All right, Mr. Eddie Liu.
Okay, thank you, Hadib. Okay, dear esteemed doctors, friends, a very warm welcome to all of you from around the world. My name is Mr. Eddie Liu, founder of FATS, Forum of Adipose Tissue and Stem Cell. FATS was founded in the year 2009, which served as a dedicated educational platform in the field of regenerative medicine and surgery. For the past 14 years, FATS have hosted many world-renowned experts in our annual FATS Bangkok on-site conference and webinar. Tonight, we are very honored to host FATS Advancing Anatomy Education, the Basics of Facial Anatomy webinar by Dr. Safi Kang from South Korea. Dr. Safi Kang is the founder of KCCS and KSKCS Korea. Also, I would like to take this opportunity to express my sincere thank you to Assistant Professor Tanom Bunaprasad and Dr. Kritsada Kowitwibool from Chulalongkorn Cadaver Surgical Training Center, Chulalongkorn University, Bangkok, Thailand, for their unconditional support hosting the upcoming FATS hands-on cadaver course, full face anatomy dissection and facial fat injection technique on 22nd of April 2023. Last and not least, to all our friends, Mr. Marut from Thailand, Mr. Jonathan Longtok, Spark Industry Philippines, Mr. Peter Jong, South Korea, Mr. Simon Tan from Malaysia, Mr. David Tay, Rido Marketing Malaysia, Mr. Tony, Victor Surgical Instruments, Thailand, Mr. Wakas, Germany International Medical Thailand, Mr. Vichai, Max High Top, Thailand, and Dr. Katip Tiwimo for their kindness in promoting this webinar, where we have reached 1,000 plus registration is a milestone. Thank you again for all participants for taking your precious Sunday joining us tonight. Please enjoy the webinar.
Thank you, Mr. Eddie Liu, for organizing this event, this Advancing Anatomy Education webinar series. And now moving on to the basics of facial anatomy, Dr. Safi Kang, who is the MD, and he's got a PhD in human anatomy and cell biology, South Korea. He has got a lot of credentials with him, but what we're going to do is we're going to summarize it because of the fact that we want to keep it short. So he's the director of Shimian Oculoplastic Clinic in Seoul. He's a publisher and founder of Journal of Cosmetic Medicine, and he's the founder of KCCS and KSKCS. All right. And the next person that we would like to present also is our moderator, Dr. Kritsada Kowitwibool. He's a facial plastic surgeon from Thailand. Thai facial plastic surgeon at King Chulalongkorn Memorial Hospital and Chulalongkorn University, Thailand's first double board certified in facial plastic and reconstructive surgery, International Board for Certification in Facial Plastic and Reconstructive Surgery, IBCFPRS, which is sponsored by IFFPSS, and Diplomate Thai Board of Facial Plastic and Reconstructive Surgery. All right, so now what we would like to do is Dr. Safi, would you like to start your presentation?
Good evening. I'm very glad to meet you all. I am Dr. Safi from Seoul, Korea. I'm now working at Simiano Plastic Clinic in Korea, and I'm very happy to share my experience about facial anatomy related with the fat grafting. So that's why today I would like to talk 3 topics about the basic facial anatomy, and then fat harvesting technique, and last one is facial fat injection technique. I really hope you have fun and exciting time today. And first is about anatomy. As we know that the basic facial unit is actually regional aesthetic unit of the face. It's therefore to emphasize the need for restoring facial skin unit and complete the lesions as opposed to patchwork. So that's why this is a very important concept, and we should realize, you should understand this functional aesthetic unit. And the left is about the soft tissue foundation. That is my concept. So I will talk about this in the later. From the cadaver dissection, and you can see the continuous, right, the subcutaneous fat layer is seen after removal of skin. And this is the from anterior. You can see the anterior surface of the SMARS, and whole layer of SMARS is seen, and the deep fat and muscle you can see. Actually, that look very simple, but quite complicated. In face, there's 2 kind of fat layer. It mostly affects facial contour on the skin. And the superficial fat is located over or densely attached to the SMARS. And the fat is located behind the SMARS or facial muscles. Superficial fat looks a continuous layer. It occupies 56% of total facial fat. On the other hand, each deep fat occupies that of 44%. As you see, the superficial fat layer is densely stuck in the space, which is formed by photoreceptor as a form of a small yellow lobule. And but the fat is very usually held by a honeycomb of fascia. Recently, superficial fat was known not as a continuous layer, but as a separate by each septum. It can be compartmentalized as like a big portal. I drew this portal by myself. It took almost 1 month. Let's look at the location of each fat compartment. And then you can understand the location of each superficial fat compartment. And this superficial fat compartment is divided by this septum. And this is done of fixation, is fused the several septum together. This fat is discontinuous and partitioned as an independent structure, and it is enveloped by the non-vascularized fascia that most likely present the fusion zone of vascular fascia. Deep fat contribute to facial expressions and mastication abilities. And then you can see the deep fat, gallal fat, and brow, and listal space, middle part of deep medial fat, lateral deep medial fat, cheek fat, then the middle surf, lateral surf, and vocal fat, and then deep lateral deep fat, and then deep submental fat. When we try to modify facial contour using fat or filler, without any sagging appearances, this deep fat would be the most important target layer. To improve the facial aging by only modifying subcutaneous fat layer, compartment-specific volume restorations, which was proposed by Dr. Gerloff, should be recommended. However, in my opinion, it would not be easy to perform the fat grafting for each compartment because first, it's not easy to precisely know this compartment on the skin. Second, several compartments abut each other and forms layers. The interaction between each compartment has to be considered. So it is not enough to improve it perfectly. Third, aging is not caused or not only by deformity of fat layer, but caused by dynamic changes of whole facial tissue, especially deep fat and bone. Let's talk about blood supply of the face. This slide shows general feature of arterial supply for the face. Mainly, it emerged from the external and internal carotid artery. At least we should understand the schematic location of vessel. As you know, these are 5 branches from the external carotid artery system: facial artery and occipital, posterior auricular, superficial temporal, and maxillary. It is important to understand arterial system of the face. So that you can see there are 3 vascular plexus in the soft tissue. Among them, subdermal plexus doesn't have a proper communication with surrounding areas. So if the fat is over-injected into the plexus layer, destroyed by liposuction or facelift accidentally, the vascular occlusion frequently happens. That's why when do incisional facelift showing like this, right lower proportion, minimal fat layer showing glistening appearance of fat layer should be preserved. The skin and fat layer contains safely dermal vascular plexus. Too much inject the fat, aggressive liposuction, and cutting the perforator of subdermal plexus must be avoided. This showing the most frequently affected hyaluronic acid and melanocyte, defined as a shaded purple. It coincides with the chalk anastomosis between branch of the facial and ophthalmic arteries. Having a thorough knowledge of this pertinent anatomy and knowing the 6 danger zones of the face, it means we can tailor the injection techniques to maximize safety. This slide shows just how diverse anatomical variation can be. And for example, a variation of facial artery with emphasis on the superior labial arteries are seen. Actually, you can see the very variable instance of the vessel variations. This also shows the variation of facial artery about nasal fold. It diverges from 42% to 14%. In here, you can see the variation of the origin of the angular artery. It also diverges from 19 to 31%. This is a nasal pattern of facial artery. Type 1 also divide into A and B. Can see the different level of the superior labial artery. This shows different course in the placement of the nasal in the infraorbital trunk from the facial artery. You can see type 2 also be divided type 2A to B. This shows variant for the pattern of angular artery. And we are very, most of the doctors, when they inject something into the face, as a serious complication, and the stroke and blindness is a big problem. So it is caused by intraarterial fat injection. If the injection pressure is higher and it makes stroke, and a little lower the pressure, it may also cause blindness. This too is a very serious complication. So why is the vasculitis important in facial injection procedure in face? When we inject anywhere on the face, can cannulate artery, can lead to blindness. Also, the fat has been reported only 0.5 cc fat on the mouth lead to blindness as well. So when we get the intraocular injection, we should realize immediately through these symptoms and signs, and the patient complain and excruciating pain. Sudden excruciating pain is very important. And you can see the pushback on the skin, and then you can see the vasospasm and blanching on the skin. So the patient complain immediately blindness or stroke symptoms, and then later reactive thrombosis, and you can see a few days later you can experience the ischemic skin necrosis and vesicles, and then finally on the skin you can get the patient get atrophic scar. About the vein, and it is necessary to understand the facial venous drainage system. Facial vein, as you know, has no valve. Actually, in face, the vein is directly communicated with the cavernous sinus for pain, and we know that what is the importance of a dangerous triangle along the nose, and the infection can spread to brain through this retrograding intracranial venous system. And then from the temporal side, we know the retromandibular vein, and then it goes to directly facial vein and finally lung. That's why you can see the temporal venous system, and then there's the important vein of the middle temporal vein. And then if we inject something and destroy the vessel, and some fat or fluid go into the vessel, and then it directly goes to the intravenous cava, and then through the retromandibular vein goes direct to the lung, and then finally, patient complain dyspnea and then respiratory failure symptoms. Now, how to avoid vascular accident? Actually, we know that now we don't use anymore with a sharp needle for injection. And then all the time you should approach back of the syringe. And then most important things I would like to say is to practically is to inject the fat or filler while drawing back the cannula. But the cannula should be inserted into the target area and depth. And then the fat should be placed while drawing back the cannula. Must not inject forwarding the cannula going to target area. Even if cannula were inserted inside the vessel, when you inject while drawing the cannula, only small fat or less fat can be injected into the vessel. However, the fat is injected while advancing for the cannula, instantly loss of fat can go into vessel. And then the cannula should be blunt, more than 20 gauge, more than the size of 20 gauge. And then actually the deeper the layer, the more fat is injected. And then insert the small amount, maybe 20, at least 10 more and 20 passes per 1 cc syringe. And 1 cc syringe is better than the larger one. And then you should use ideal syringe grip. And then another understanding thing is when we do the filler or fat injection into the face, you should check out the history of injections, because in the first session of filler or after first session of filler of fat, the vessel is moving well before the injection of filler of fat. In the natural, the bulging case inside the vessel is moving well and relatively free in the tissue. But however, after first and second session, and then the fat or filler at the curve and the locators around the vessel, and the vessel is fixed and the less movable. So that's why if you much more volume, the incidence of penetration of the cannula during the PET injection is increased. Become high instance, even when you use the blunt cannula. Until now, we have talked about the importance of anatomy to prevent the serious complications can occur with the fat grafting. However, despite the detailed published reported description of the facial vasculature, actually anatomy can be quite variable. But it's very difficult to know where is the exact location, exact depth. So vascular injury occur at any time, even after best precautions are taken. Likewise, actual cannula depths can be difficult to track, sometimes unpredictable, actually. Even I'm the anatomist, even I did not use the ultrasound, actually very difficult to know the exact layer, exact position, and exact placement. So most importantly, we need to recognize complication in a timely manner and then take up the appropriate measure to minimize what can be serious result. But shouldn't stop to learn about anatomy? No. Anyway, as a doctor, for the responsibility for the patient, anyway, we should learn more, and then we should get more experience to further for injection techniques. And that we should increase the skill to get the more experience to protect the patient. And SMAS, as you know, actually SMAS is a very important part of the facial layer, but the only thing is the concern with the fat grafting. If the fat or parotid muscle region of SMAS is the thickest and most uniform, but the part of the fat is reduced, it leads lateral depression, cheek depression, and get worse, the sagging jaw as well. So we can inject fat into this area of SMAS. Another important structure is ligament fixation. It's located at the mobile between two planes, each other, the superficial, the deep fascia, and there's three kinds of ligament, the septum and the ligamentum adhesum. So that's why, and then as you know that there's two kinds of lateral ligament, and the true type and false type. True is connecting bone to skin, false is connecting the skin to muscle. That's why I will talk about the importance of this ligament in aging session. When you do evaluate the patient face for the injection something, do you usually touch the patient facial bone? Bone is the primary structure of facial contour, like a foundation, pillar of the house. That is why even there's a serious facial volume deficits or asymmetrical facial proportions, you should check the bone shape first, and then should consider correlation with the facial soft tissue. In my opinion, and is there any soft tissue volume defect, should try to find the fundamental reason from the bony defect first, and then evaluate the degree of volume defect related with the habitual facial animation and aging. Next is muscular development. It's an important factor for the facial contour, mostly for augmentation, lifting the lateral brow and mid-face. Temporalized muscle is frequently recommended. For reduction, as you know, masseter muscle is targeted for V-shaped low facial contour. Muscular arrangement is also important. So when you want to increase the survival rate of fat, and then botulinum toxin, sometimes it's best to wait, prevent this low survival rate and decrease less fibrosis. Until now, we have talked about anatomy closely linked with the fat grafting, mainly focused on prevention of serious complication. As you see here, superficial and deep fat SMAS return ligament with the periosteum can be used as a target structure on the basis of a function of each structure for soft tissue volumizing and contouring, facial contouring by fat grafting. I need to talk to you about the aging because aging is very important to prevent this unnatural facial contour by fat grafting. So actually, we can try to increase voice volume. We cannot have what consider about aging in the elder person and underdevelopment in young person. Because the severity of a facial volume defect or sagging is basically and very closely is the bone deformity in older or even younger patients. In general, aged person, you can see the sagging appearance on the face due to due to facial volume redistribution by aging. The certain areas is loss of soft tissue fluids shown as a green colored areas, or the hypertrophic regions shown as the violet colored areas. Because of the different soft tissue foundations, that the soft tissue gradually sag in the direction of anterior and inferior. Natural fold is most common complaint from the patient to suffering this fold. So we have tried to improve this deep natural fold, but we should know the understanding the reason of deep natural fold. Dr. Yoshif suggests gravitational deflection, and then Dr. Kosain suggests reduction of prominence of natural fold, improved our area at locate the from margin, malafet decrease. So there's a two concept. And recently, there's a two hypotheses, very interesting. One is the compartmental migration, and the other is intercompartmental shift hypothesis. So this is minimally that the important thing is upper part volume decrease, low part volume increase. Aging of smooth, so elastic fiber is degeneration, elasticity is decreased. So retained ligament is also important in the young people. Retained ligament is a tight and thick part, and with aging, ligament attention happens. So it is result in sagging of all elements of soft tissue. So we can inject the fat into the ligament, but in the surrounding ligament, we can increase the tightening and the strengthening of this ligament by fat grafting. Bone changing also important. According to the lumbar theory, with aging, the facial bone shape is changing like a clockwise rotation. So the forehead move forward and mid-face move back. Correspondingly, the soft tissue naturally moved back and down. As a further concrete concept of the lumbar theory, bone resorption theory was suggested by Dr. Mandelson. He described the change in the facial skeletal framework resulting from the aging is caused by bone resorptions. The area occurring bone resorption also correspond to the more mobile parts of the face during animations. The evidence of aging manifested by the soft tissue correspond is the area of weakened skeletal support. In conclusion, in order to correct the contour of the soft tissue, it is important to first try to correct the bone change first. When I teach my fellow, it's very pleasure of teaching, and they also, when they learn about my technique, they also my fellow also be happy together.
Yep.
As a second session, okay, a second session, I'd like to talk about fat harvesting technique. Just very practical and practical technique. I will talk about this only practical technique. How to harvest, prevent bleeding and irregularity. That is the focus today. My focusing today is how to prevent bleeding, how to prevent irregularity from the donor site of fat grafting. Okay. So today focus, as I talked just before, how to harvest easily, prevent intraoperative bleeding and postoperative irregularity. Okay. On the basis of a client solution, there's different modified client solution, as you see from the table, and then you can make a choice. You can make choice the different solution according to the different donor site. As the most favorite site for the fat harvesting is abdomen and lateral side, usually recommended. However, the site can be decided by the condition and requirement of the patient and the purpose of the graft and the physician's compatibility. There's an interesting report by Dr. Scheffer and his group. Abdomen is the better harvest site due to its stronger resistance against adipose-derived stem cell apoptosis. In the superficial fat layer, which is located above the scalpel's pressure, is compared to the deep fat layer under pressure. So, personally, I think the best layer is the superficial fat layer above the scalpel's pressure. You can use this. You can use ADS advantage. While inject tumescent solution for anesthesia, which layer should be injected first? Practically, the middle layer over scalpel pressure is the best for easy and comfortable for the physicians and less painful for the patient as well. Now, I try to talk about the several questions for the easy, comfort, and successful liposuction. First, excessive injection should be avoided, or else adverse sites are damaged due to pressure when too much are injected. Second, tumescent solution is suddenly injected with a huge volume and with high pressure, it develops a lake in tissue. And it causes failure, even anesthesia, or take too much time, and even sufficient liposuction may not succeed. Third, pressing or massaging of the hand to even dispute the inject tumescent must be avoided because it promotes the damage of natural adipose sites. I will show this technique in my video. During the liposuctions for harvest, which level of the negative pressure is less harmful to the aspirated vessels? It's known when and 1 to 2 of negative pressure space in the barrel of a syringe. And the cannula connect with a 25 centimeter length with a 3 millimeter diameter. And to connect with the 10 cc work syringe, I will show you this technique in my video. For the harvesting, less bleed, contaminate, aspirated fat, we can approach this segmental liposuction. In case of bleeding during suction at one segment, liposuction should be performed at the other or next segment. However, it is important to pay attention to avoid the formation of irregularity between segments. During the liposuction, the cannula should be moved back and forth. At this time, if your cannula moves only in half length of the cannula, and then you try to change the direction of the cannula, you can make the artificial fold like a figure B. It makes difficult and uncomfortable cannula movement. Eventually, you can feel it's very hard work and the suctioning may not be successful. If you do suction in the state of a photo B, you cannot visualize well the sense of location and the placement of a cannula. It causes damage to the tissue and leads to pain, bleeding, and irregularity as well. For prevention of this, the cannula should be moved back and forth with its entire length, which is from the entry site to the marking line. The direction of a cannula should be changed near the entry site as shown in figure A. You may have some fears about abdominal penetrations by cannula during the liposuction. If so, how to move the cannula from the superficial layer to deep layer safely? Some doctors change the angle of a cannula by dominant hand. However, it is very dangerous. If the doctor doesn't have a good sensing for the cannula movement and its locations, the incidence of a serious complication like a multiple intestinal perforation may increase. If so, how to place the cannula at superficial or middle or deep layer? In principle, the cannula of the right dominant hands always should be moved parallel to the abdominal wall, and the left hand must feel the location of the cannula during suction, and it participates in an important assisting role when the cannula should be moved to deeper or more superficial layer for liposuction. For the deep liposuction, left hand push skin toward the anterior side as shown in figure A, or pinch the skin or subcutaneous tissue up with the thumb and finger in figure C. For the superficial liposuction, the left hand pulls skin away from the anterior side as shown in figure B, or touches press gently with the palm like in figure D. These assisting actions are very substantial for the facilitating suctions by making easy and precise cannula movement depending on depth and locations. As you see, instrument for the fat graft is quite simple and very cost effective. This slide shows when I teach my fellow in operation room, almost my teaching is a hand-on hands. And then this is first time to harvest. Done my fellow and very successful and without any bleeding. I'm actually in my education field. I'm teaching the fat grafting and then blepharoplasty. We have a cunning blepharoplasty workshop, and then together cooperate with the FATS, we'll hold international congress in October 13 to 14 in Seoul, Korea. Hope you looking forward to see you in there. See you there. Now I'd like to talk about my last the title of today's topic about the facial fat injection technique. There's two purposes of fat grafting. The first is to correct the mild, moderate wrinkle, fold, and depression. This like an artificial filler injection for less weight volume defect. However, in case of older persons who have a severe type of wrinkle, fold, and depressions, as the simple way only to correct the surface volume restoration is always insufficient and sometimes caused unnatural result. So as I mentioned about anatomy and aging process, my idea to prevent this and to get successful results is that the fat should be preferentially injected to modify the bony deformity first and then correct the soft tissue volume defect secondly. It eventually corrects the severe volume defect is a natural and a lifted facial contour. This slide shows the relation between size of malar bone and the soft tissue sagging and degree of aging. Even this lady is the same age, 20s. Left side, a lady has smaller malar bone and has a deeper medullary fold with a sagging jaw, compared to the lady at the right, who has a large malar bone, but she has no dim medullary fold, no sagging appearance. In 50s, we can observe the lady who has a larger malar bone, right side, and has less dim medullary fold and less sagging appearance, compared to the lady, the left foot of the lady who has a small malar bones. This is an obvious evidence showing the stronger skeletal support, less soft tissue sagging. That's why the patient complains with the dim medullary fold sagging, we should check the size of malar. Very important. So when you do the fat injection, you should correct the bone deformity from the malar side first, and then correct the soft tissue volume defect second. So that's why my hypothesis to correct the soft facial contour is always to correct the sclera deformity first, and then soft tissue deformity second by fat grafting. Bone contouring surgery or implantation is the best way to modify the bone shape of the facial contour. However, even though the graft fat is not strong as the bone or implant, it is expected to improve the bearing capacity of the soft tissue if the fat grafting is made like a most curved stone. It's getting larger on the periosteum than most uncovered stone is. The size of the bone is got bigger as the graft fat is performed by attaching fat to the bone. The soft tissue foundation will be increased, and although the weight to volume is increased by fat grafting, sagging with unnatural contour will be prevented. This is the hypothesis to divide the face into three regions, because this region has different soft tissue foundations. The red color strong, the soft tissue foundation area is composed of a very strong bone and true ligament. This part is strongly supported by bone and ligament, strong ligament. The second strongest soft tissue foundation area is a blue color. It is lateral cheek portions formed by well-developed mass and the strong muscle muscles and protuberance and the soft tissue, but also that's supported by posterior ligament, relatively strong. There's also composed lateral wall cavity. The yellow part is weakest, strong soft tissue foundations. So that's why, because there's a composed of the small facial muscle, movable facial muscle, and the elastic fiber, and then there's the anterior part of wall cavity very relaxed. So that's why this part, yellow part, is the weakest soft tissue fiber area. So in this situation, when we inject the same volume of the fat or filler into the same level, the final shape inside the soft tissue would be different like this because of different soft tissue foundation. For example, if there's two areas of fat injection like A and B, which area should be injected first and second? This is the beginning of a concept of sequence of injection for prevention of sagging, depends on the soft tissue foundations. If we inject A first, as shown in upper low, we can get the volumetric lifting is using the small amount of fat. However, in case of injection of the fat into the B first and then A second, we may have a sagging appearance because the B area has already sagged due to weakest soft tissue foundation. Eventually need to inject more fat into A area. Finally, it may show unnatural appearance. So my basic concept was fat grafting is to do A first and then B. This is the regular sequence in my concept. So for this, I divide the face into 5 zones by 4 sublines on the basis of anti-gravitational vector and different soft tissue foundation with considering of the soft tissue foundation related important structures such as retained ligament, bone, fat, muscle, and skin. This shows the map of sequential injection. The face is divided in 5 zones by 4 satellites, and then we can inject the fat from the zone to zone 1 to zone 5, and in zone from the upper area first, and then low area from 2, and within 1 zone, and we can inject deep to superficial. And this schematic video shows the concept of the volumetric lifting. So that's why zone in, we inject the fat, and then the lower part of the soft tissue lift up, moving and lift up like this. Volume increase upper part and the lower part, skin and soft tissue will lift up by the volume augmentation. This photo shows the sequence of placement and amount of fat grafting for each lesion. Why should we inject the filler from the deep to superficial layer? Why we should inject more volume at the deeper level? Why we should inject the filler from the deep to superficial layer sequentially? These are all for prevention of sagging with natural control. You can see the real evidence of volumetric lifting in a 55-year-old man with a dim edgebeard form. And the fat was sequentially injected into the palpebral malogroup, malamount, and theotrope, and then milchicuro in a regular order. You can see the volume increase. In upper middle face and eyelid lesion, and then other hand, and then we can see the shortened mid-cheek junction. And on the other hand, we can observe the volume decrease from the mandible fold and jaw. Actually, you can see the softened lateral fold, unfolded lateral fold, and the total face look lifted. These photos had taken during fat injections. You can see the change of contour. Volume like this. When we inject the fat into the malar area, volume increase in malar region, and you can see the change of contour and the before and after. At the upper part, increase volume, lower part, decrease volume, and then contour change. And let's watch the full course of Safi technique for fat grafting. Hope you enjoy the video looking back on my lecture today. You can see the space for proper negative pressure. And then you should see the moving of my cannula. Liposuction from the middle superficial fat layer first. And then I prefer to use the subcutaneous fat layer, superficial subcutaneous layer. That the part is the structural very nice. You can see the negative pressure inside the sheathing. This is basic technique to purify the cell separation of purify and separate the fat cell by centrifugation. total, I use the turmeric solution. The total amount of for whole face is about 10 cc. You should see my finger. Do not see the area. How to hold, how to inject the fat. And then you see my right hand and the left hand together. How to place the tunnel level and depth. Now I'm touch the bone and stretch the bone and injecting the fat just above the supraperitoneal layer. And now it's injecting the sum layer and then superficial layer. This one layer, the deep supraperitoneal layer first, then deep layer second, the full layer, the superficial fat, and the last is abdominal layer. And then the medial side, there's an angular artery, but if you make an entry site on this side, you can prevent the angular artery injection. You can prevent intra-articular injection. And then, okay. This is to my Safi books, published in the Korean edition, 2011, and then published by English edition in 2016. I show you the research by Safi technique. A 10 years old lady, she wants to improve the facial contour and want to improve the sagging appearance by fat grafting. After 3 months, you can see compare the before and after 3 months. Total face contour is changed with lifted appearance. If there's any irregularity and sagging appearance. 25 years with the blepharoplasty together, and then before and after. You can see the change. Look, the mid face look small and narrow, and the total face contour is total face just looks smaller than before. This is 18 months after research. The 20-year-old lady, she complained of symmetrical case. You can see the right side, the bone is small and the sagging much more than her face looked asymmetrical. And then I did the Safi technique to correct the bone deformity first, and then inject the fat into the soft tissue. And then you can see the 6 months after surgery, and then you can see the symmetrical face and the sagging appearance was disappeared. Total face was lifted and looked younger. This 30-year-old woman, she want the charming and soften the facial contour, and then this is 6 months after, and she want to improve the face contour. The mid face look like apple, so you can see the change of the contour from the oblique view before and after. You can see the 6 months after the contour of changing of the mid face volume without any sagging appearance. And the opposite side of oblique view, you can see the change of contour of the mid face, and then even volume increase a lot, but there's no sagging appearance. From the lateral view, you can see the change of the lower lid and the cornea and the orbital bone relations is the before and after the 6 months. You can see change of mid face contouring. This is 45-year-old lady want to look the small and the charming appearance. That I did the blepharoplasty and fat grafting together. And 1 month after, her face, the total facial contour was significantly changed. And then even she got by the weight of 3.5 kilogram 6 months after, the effect is still maintained. There's no sagging appearance with even she has a lifted appearance and V-shaped lower face contour. Still very nice. This 55-year-old lady, she wanted to be looked as she was a high school. So I tried the 3 times, two times 2 times the fresh fat injection, and then the 4 years after, 4 years and 5 days after, she had very satisfied with her research. And from the oblique view, you can see the quite very nice volume illustration without any sagging appearance. This shows the possible complication of the fat grafting, but my FATS technique of the Safi, that is a very layer and no complication about bulging and the skin drooping appearance. The photo shows that the completion of the Safi education, and then they have certificate with they photo together with my Kowitwibool. And April 13 to 14, I will open the facial lipoplasty in Seoul, Korea, in my Simyang clinic. Thank you for your attention.
Dr. Safi, for this very insightful presentation. All right. Any questions from the floor to ask Dr. Safi Kang? Dr. Kritsada will be moderating these questions.
Yes, there are many questions from the floor. I think it's not. I have, because the time is running out, I have just one or two, the few questions. The first one, that how many cc of the tumescent per area that you frequently use, like the abdomen or the lateral thigh? How many cc of tumescent that you use, almost that you use?
Yes, and if I want to harvest 100 cc of fat, I inject at least 100 to 200, maximally 200 cc tumescent I use. But it depends on the patient sense of pain. Patient don't want the painful, do not want to get painful feelings. I inject more of tumescent, not actually inside, not into the area for harvest, but surrounding area. I inject much more. That is the way to prevent the pain.
I see. Okay, another question from the participants. They ask for, can you do the high intensity focused ultrasound or the RF after the fat grafting? When you have to start to use the HIFU or RF and the good effect for the result?
Yes. When we do the fat grafting, the first maturation would finished and 3 months after the fat grafting, first maturation period. So that's why another concept is that you should you take care of the stem cells settle down. So actually, when the patient want to the HIFU or RF, I recommend to apply the second session as a second year for treatment to lifting. I recommend 6 months after the first session of fat grafting.
Yes, and another question, short. How many minutes did you wait after the tumescent injection? You wait how many minutes before do the liposuction?
Yes, actually the time of the actual lidocaine is we need at least 10 minutes. But in my personal experience, actually at least 20, 30 minutes waiting and then do liposuction, you can prevent the bleeding.
Okay, because of time frame, we can only take one more question. I'm sorry, but because of the fact that we've got to skip to our time schedule. So Dr. Kritsada, you have a choice of asking who would like to have the question presented to Dr. Safi.
Yes. The last question is how you estimate the volume per area. I mean, if you have liposuction for the abdomen, how you evaluate or estimate the volume, the fat that you can get?
It depends on the amount of tumescent solutions. If I actually for the beginner, when we inject maybe for example 200 cc of tumescent solution into the recipient side, into the donate side, actually for the beginner, not much. But in my case, in my experience, if I inject 100 cc of tumescent, I can get 100 cc of fat, something like that.
I think we have to come to learn from you. Okay, finish. Yes.
Thank you, Dr. Safi Kang, for answering these questions. And I know we have a lot of questions from our our participants. We are just so sorry because the time doesn't permit us to continue with these questions. Anatomy dissection and the facial fat injection techniques, presented by Dr. Safi Kang and moderated by Dr. Kritsada again. And this is going to be done at the Soft Cadaver Surgical Training Center, Chulalongkorn University, Bangkok in Thailand on the 22nd of April 2023. And for this, right, what is going to be happening is the learning objectives are understanding facial anatomy and vascular anatomy, understanding different compartments of fat pads, anatomy basis of safe injection technique, avoiding intravascular injection that may lead to blindness, blind soft tissue. Wait a minute, my screen is a bit irritating. So blindness and soft tissue necrosis, blocked nerve and LA infiltration to the face, fat processing and manual fat injection techniques. So this is what is going to be presented on the 22nd of April. Yeah, that would be great. All right, Dr. Kritsada, maybe you could provide the voiceover for it.
Okay, this I think everybody know, but someone is not know that our surgical center is located in the center city of the Bangkok, near the park. So it's easy to access by the subway and sky train, and a lot of hotel around there, shopping centers and another stuff. We also have the facility for the new renovated of the conference room and the lab stations, and we have the 4K monitors, and we have to well prepare for the safety of the soft cadaver to make sure that you will be safety when you do the workshop. And we also have many of the course from the orthopedic surgeons, oculoplastic surgeon, the endoscopic, laparoscopic, and some of the dentists, neurologists, neurosurgeons, and some of the eye surgeries.
All right.
So,
Thank
you so much for if you want to visit our surgical training center.
Thank you so much. All right. So yes. So these are some of the pictures that have been taken during the FATS Bangkok event at December 2022. Some of the pictures, yes. And it was attended by over 80 participants. So that on its own virtue tells you how much of a successful event it was for FATS Bangkok 2022. And with this, we are also progressing on with the new cadaver event, which is the hands-on cadaver course, full face anatomy dissection and facial fat injection techniques on the 22nd of April 2023. So looking forward to seeing you all there. Dr. Safi Kang and Dr. Kritsada and everybody else here, thank you so much for being a part of this successful presentation. All right, thank you.